usual process for developing a vaccine takes between 4 to 5 years at the fastest, and that's because it's really done in a methodical, sequential, effort where you do the scientific development, then you do the human clinical trials, and then only after it's been approved do you start manufacturing and distributing it. Very early on, though, with the recognition of this pandemic, that timeline was able to be compressed. But what I want you to understand is the way that was able to be done is that the manufacturing and distribution steps were able to be done in parallel while the clinical trials were ongoing. And so these clinical trials were just as rigorous, and no corners were cut in terms of the science or the safety of the vaccines. It really was the government and really financial risk that if one of these vaccines didn't turn out to be effective, we would have already mass manufactured it. But fortunately, several of these have proven to be very effective. And that's why, in December, we were able to start rolling out the vaccine.